I'm Dr. Mark Scott. I've been in practice here in Virginia Beach since 1996, and I'm the founder of the Total Health Center. And I've been helping people with chronic pain for over 16 years. In this video, I'm going to show you the latest cutting-edge, non-surgical, non-drug breakthroughs in eliminating knee pain. In my 16 years in practice, I've found that 20% of knee pain patients just have knee pain. 80% have a functional problem. That's why they've not gotten any better. The reason these patients have not responded is because they are functional medicine cases, and no other doctor has done the thorough testing that these patients need. So what do I mean by functional medicine cases? Functional medicine is about evaluating the body's function, not just treating symptoms. A simple example would be high cholesterol. In our current approach, your doctor will prescribe a medication to push your cholesterol back to a given range. That's all fine and good, but does anyone even ask the question, why is my cholesterol high? And what can I do to get back to the point that I was before I needed medications for life? High cholesterol can be caused by many different things. Diet, liver dysfunction, high blood sugar, stress, just to name a few. But instead of looking for the cause, your doctors are trained to just give statin drugs and move on. The same thing happens with knee conditions. The specialists are looking just at the knee, but there can be multiple components that cause knee problems. Neurological, orthopedic, metabolic. So some neurological components would be things like numbness and tingling in the feet, legs, hands. And these may be neurological deficits that you don't even feel. Pain that's over the entire body. Balance disorders. Underlying neurological conditions, whether it's stroke, MS, tremors. Orthopedic concerns, things like an imbalance in alignment of the pelvis, where one hip is higher than the other, and that's causing abnormal strain on the knee. One leg being longer than the other. So we have what's called an anatomical short leg or a functional short leg. So an anatomical short leg is where the actual bones are actually shorter. This can also be caused by an imbalance in the pelvis, where the pelvis is kind of torqued, and that can cause the knee to appear that the leg's longer. Sometimes you have a dropped arch in the foot, and that can cause imbalance in the legs. Or muscular imbalances, whether it's the hamstrings, the quads, the low back, etc. All these different things can contribute to imbalances in the orthopedic structure, causing pain and pressure on your knee. Metabolic component. So again, this is something that's not often looked at. In addition to knee pain, you may have blood sugar issues, anemia, inflammation, infections, food sensitivities and reactivity, free radicals and excitotoxins, detoxification issues like the liver, the lymphatic system, the kidneys, autoimmune issues where the immune system is reacting adversely, and this may be even affecting the chronic inflammation in the joints. So if your immune system is attacking your joints, that could be a big problem. That's what I mean by functional evaluation. It could be more than just knee pain, and that is what we need to find out. We need to find out if you're in the 20% with just knee pain or the 80% with a functional problem. So what are we going to do to figure this out? Get to the cause of your knee pain by neurological testing, metabolic testing, orthopedic testing, doing the proper labs. So first let's discuss a little bit about our current approach that you've probably already experienced, our current medical approach. Number one is medications, right? Some type of drug, some type of anti-inflammatory, some type of pain medication, to kind of push the pain down, block the pain, reduce inflammation. Surgery, try to repair the damaged tissue that's caused by the inflammation, or a knee replacement. But again, this is the extent that most patients see. So the one point I want you to really think about is all the experts from Virginia Beach to the Mayo Clinic, these are experts in drug and surgical treatment. It's a very key distinction. So many medications have side effects, and again, there's no guarantee that $40,000, $50,000 knee surgery is going to really work for you. I see the medical professional failures in my office on a daily basis. So my approach is integrative. So we're going to do some detailed neurological testing. Vibration, checking the large diameter afferents. These are nerves that fire 270 miles per hour to the brain. These large diameter afferents are the first types of nerves that can be demyelinated. And demyelination just means that the outer covering of the nerve is starting to break down. And this can cause abnormal impulses going from the joints to the brains. And these large diameter afferents also inhibit pain. So why would this happen? Why would they demyelinate? Well, you can have immune problems. You can have cholesterol problems. And that's a big one. Digestive problems, lack of nutrients, fatty acid metabolism imbalances, different medications. So you have to treat the person, not just the condition. Just like if your front end on your car is out of alignment, your tire's going to wear out faster. It's not a tire problem. Your knee problem may actually not be a knee problem at all. So some other neurological tests we may be looking at, things like two-point discrimination, joint position sense, reflexes, even eye movements, cranial nerves, Romberg's test, which is a test where we test your proprioceptive input, step tests. So again, there's lots of different testing we're going to do to evaluate your neurological function. So the question is this a nerve issue or is it part of the issue? A lot of my patients will be a combination of actual damage to the knee, contributed by neurological imbalances and metabolic imbalances. So there may be different percentages that you're being affected. Are the proprioceptors in your joints giving your brain bad information? Well, we're going to find out. Metabolic testing, as I mentioned, we're going to look at causes of chronic pain and inflammation, toxicity, autoimmune issues. What causes massive inflammation, toxicity, and decreased immune responses. If you have chronic knee pain or pain all over the body, this could be caused by over-acidity, decreased minerals, massive inflammation. Inflammation will cause destruction to your joints. So have you ever heard of arthritis? Well, what is arthritis? Arthur means joint, and itis means inflammation. Hello? Right? Joint inflammation. So it's not just old age, it's not just some disease that attacks you. There's a reason for it. So that's what I do. I do the detective work to try to figure out what needs to be done and find the cause, not just give everyone anti-inflammatories or give everyone laser treatment and just see who responds. We need to figure out what you need and what combination of things you need. So again, your orthopedic surgeon, they're surgeons. They're looking to do surgery. Pain management, they're going to do injections, try to help block the pain. Physical therapy is going to give you some exercises. Chiropractors are going to adjust the joints, et cetera, et cetera. And all these have their place, for certain conditions. But to truly solve these cases, you have to look at everything, not just one specialty. So number 2 is massive inflammation, toxicity, and decreased immune response. These can be caused by free radicals and excitotoxins. And free radicals and excitotoxins are all over our environment, and it really depends on how your body is dealing with them. So long before any type of chronic pain had been diagnosed, the affected individual has typically been exposed to a varied host of these different toxicities, whether it's heavy metals, toxic chemicals, inadequate nutrition, which can lead to free radicals and excitotoxins. There was a study that was done in 2004 that looked at the overlooked role of chronic infections in neurodegenerative diseases. And this is another issue we see a lot of. Massive inflammation, toxicity, and decreased immune response caused by infections. If you have a chronic knee pain, or any type of pain for that matter, your immune system could be attacking your joints. And infections could be the trigger. Sometimes undiagnosed subclinical infections that no one really has any idea are even affecting them, but your immune system is aware of it. It could be a dental infection. It's kind of under the radar screen. Gut infections, parasites, mycoplasmas, biofilms, H. pylori, or other different bacteria, or just imbalance in the healthy bacteria. Organ infections, liver flukes, bone and joint infections. Number 4 is massive infection, toxicity, and decreased immune response from autoimmunity. What does this mean? This means that your immune system is attacking your own body. And how do you stop your immune system from attacking your body? Again, first we have to figure out what's causing it, and then decrease the inflammation, detoxify what's caused the immune system to react, and strengthen and rebuild the immune system. Your immune system has 2 main parts, something called Th1 and Th2. And you need to increase the function of one of those sections or balance them out. And again, we may need to do some blood testing to evaluate this. But balance is the key. 80% of your immune system is in your gut. One of the biggest problems I see in any chronic pain patient is poor gastrointestinal function. Constipation, gas, bloating, reflux, cramping, poor assimilation of fatty acids, and vital nutrients, causing chronic inflammation, pain, and weakness, etc., etc. And this is very common in our society. And most people just chalk it up to just kind of the way things are. I get a little gassy, I get a little bloaty, I get full, but it's not really causing any problems. Well, that may not be the case. Is this really contributing to your knee pain? Hypochlorhydria. So again, this is a big one. We see this all the time on TV, reflux or GERD. And what do? They give you a proton pump inhibitor, which blocks all your stomach acid. So yeah, that's a whole other topic we could talk about. But the bottom line is that a lot of these patients are being managed inappropriately, and this is causing decreased stomach acid. Without proper stomach acid, your body can't function. The proper hydrochloric acid allows better flow of your lymphatic system. It helps create methyl groups, which is another big important issue. So again, how do we test for this? We're going to do some blood work. We're going to look at total protein, serum globulin, blood urea nitrogen, phosphorus. So again, function, not just covering up the symptoms with an antacid. Did you ever wonder why all of a sudden you have chronic knee pain, or for that matter, any type of pain? Does it come and go sometimes without any logical rationale? So again, most people chalk this up to arthritis. But arthritis, again, is inflammation of the joint. So a lot of times we'll look at an x-ray and we'll see signs of arthritis. But some of those patients have pain at sometimes, and sometimes they don't. But that arthritis is always there on that x-ray. There's studies that have shown that there are people with osteoarthritis, even severe osteoarthritis, that don't have any pain. And that's what we're going to focus on. Why? What's causing the pain? What's causing the inflammation? So a quick review of some of from a metabolic perspective. Causes of chronic knee pain, or any chronic pain for that matter, can be inflammation, toxicity, and decreased immune function. Overacidity, free radicals, infections, autoimmunity. So again, has any specialist that you've seen to this point explained why you have this pain? Why you have chronic inflammation in the knee? What's most difficult for many of my patients to understand is that things that seem unrelated to your knee can be preventing your body from healing properly. So it may not be a direct response. It may not just be the inflammation that's causing your pain in your knee. It may be the fact that your body's not functioning optimally, and the normal process of regeneration isn't working, and your knees can't heal from normal activities. And this could be causing the pain. I call this the web of physiological dysfunction. So along with chronic knee pain, you may also have other health breakers. Things like gut dysfunction. Like I said, 80% of your immune system. Blood sugar dysregulation or imbalances. Inflammation, autoimmune, anemia, lymphatic dysfunctions, liver and gallbladder dysfunction, fatty acid metabolism dysregulation, carbohydrate metabolism dysregulation, energy markers out of balance, dental work, neurotransmitter, brain dysfunctions, toxicity issues. All need to be functioning optimally in order to achieve maximum healing. So how do we do this? How do we go about helping you out and putting you back on track? Well, we use a lot of different technologies. Once we've discovered what the problem is, then we can apply the proper technologies to the right circumstance. One of the big things we use is called the MR4 Super Pulse Laser. This is going to do a number of things. This is a cutting edge laser. I've been watching lasers for years, and this is one that I really feel is cutting edge. It's going to accelerate the cell reproduction and growth of the cells in the joint. It's going to cause faster wound healing. The laser is going to stimulate fibroblast development. Also, these are like the building blocks in damaged tissues. This can help in the reduction and recovery time and speed things up. Increase metabolic activity. So it's going to help to increase the output of specific enzymes, reduce oxygen to the blood, induce oxygen into the blood cells, and more effectively enhance the immune response. Reduce fibrous tissue formation. The laser is going to reduce formation of scars and following tissues damage from cuts, scrapes, burns, and different injuries that you may have done in the past. Anti-inflammatory action. So again, it's going to help reduce inflammation locally, right at that site. So once you've identified what's causing systemic inflammation, now the laser can be more effective at reducing local inflammation. Increasing vascular nerve activity. So the laser will stimulate lymph and blood circulation to allow the affected tissues to have the best possible circulation. It may help stimulate nerve function. If you have slow recovery of the nerve dysfunction and damaged tissue, it can result in dead limbs or numb areas that aren't going to heal as fast. The laser will speed the process of nerve regeneration and bring the numbness areas back to life. The laser will increase the amplitude and action potentials of these nerve fibers and muscle fibers. We also use something called rebuilder therapy. This is an electrical therapy that's going to help rebuild the nerves. I treat a lot of peripheral neuropathy and patients with different conditions of that sort, and the rebuilder is key in helping restore nerve function. So if you have a proprioceptive problem from an old injury in the ankle or in the knee itself, we need to rebuild those nerve connections and retrain them and increase proprioceptive input, so your brain is getting clean proprioceptive information. Complete structural and functional and neurological evaluation. So again, rehabilitation protocols to help rehab weak muscles and joints, including orthotic supports, structural corrections for the spine and hips and back, knees, feet, whatever we find. So no stones can be left unturned. Complete metabolic workup, including blood testing and other functional metabolic tests to evaluate the immune system, inflammation, nutrient deficiencies, anything that could be contributing to the poor health and cause of chronic knee pain. And the beauty of what I do is that patients will come in with knee pain and leave with improved digestion, lower cholesterol, sleeping improvement, better focus, concentration, you name it. Because it's all about getting you healthy. Yes, your knee's going to get better, but you're going to get better. The bottom line is, we're going to get you healthy. In order to fix your knee, if that means losing 20 or 30 pounds, reducing inflammation, fixing the low back, restoring neurological function, etc. I could go on and on. And for many of our patients, it's truly life-changing. So ask yourself some of these following questions. How long have you had this condition? How has your chronic knee pain affected your relationships, your finance, your family, your enjoyment of activities, your quality of life? What's it cost you in time, money, happiness? Is it keeping you up at night? Where do you picture yourself in the next 1 to 5 years if this problem isn't taken care of? Your best predictor of your future is your past. If you continue to do what you've been doing, you're probably going to end up getting the same results. And what's it worth? What's it worth to you if you could have this condition improved? So your body will heal, but it needs the right tools and equipment. And our job is to provide the tools that you need. So it's important to understand that, I get a lot of requests for information, and unfortunately I can't help everybody. I'm very particular about the patients I accept. It's no fun to be working with a patient that's not responding. That's stressful for them, it's stressful for me, and I try to avoid that at all costs. Some patients just aren't good candidates. So at the end of our initial evaluation, I'm going to do what's called a report of findings. And I'm going to go over some very important things. 3 very important things. Number 1, if you're a good candidate for care. I'll let you know that right off the bat. So again, if I don't see a clear clinical path with you, I'll just let you know that. Or maybe you're not even a candidate. Maybe you actually are a surgical candidate, or you need some other treatment, and I'll make those recommendations. If you are a good candidate, though, I'll tell you what I think the underlying issues are. And if I feel there's some further testing that might need to be done, I'm going to let you know what those tests are and why they're important. And I'll also give you a good understanding of what to expect cost-wise to get your condition corrected and back on track. So I'm going to look at you from a perspective that no other doctor's ever done before. I think you're going to find it very educational and life-changing. So are you ready to have your life changed? If you are, I look forward to seeing you in the office.